Well, an ominous milestone in Utah today. 1 million official cases of COVID-19 since the pandemic began. News specialist Jed Bowl joins us live from Intermountain Healthcare in Murray. And Jed, this news comes as our state sees another spike.
Yeah, exactly, Ashley. Right now, new COVID cases and hospitalizations are on the rise here in Utah and also across the country. This surge is being fueled by the BA.5 Omicron variant, which so far proves to be among the most transmissible, but fortunately not the most deadly.
We're definitely seeing very significant transmission across the state of Utah.
Cases of COVID here and nationwide rising for a couple of months. Last week, nearly 8,000 new cases reported in Utah.
And we all know, people in our circles, in our social circuits, in our families that have tested positive for COVID recently. And so we certainly know that community transmission is quite extensive at this point.
Stenium points out cases are being undercounted because more people are testing at home, if they're testing at all. Right now, 7 counties in Utah: Salt Lake, San Juan, Summit, Tooele, Wasatch, Wayne, and Paiute have high COVID-19 community transmission levels, according to the CDC. Hospitalizations up sharply, but patients needing intensive care and COVID-related deaths have not spiked. Vaccination and prior infection provide less protection against this variant, but they still ease the severity.
At this point, we really have to look and say, what is my risk of getting COVID? What is the risk of me transmitting to high-risk individuals? And what's that impact going to be on my life?
High-risk individuals should take precautions regardless of their vaccination status. Stenium recommends masks when they are in crowded indoor spaces.
So masks, may not be right for everybody, but encourage people, especially at high risk, to really focus on what they can do to reduce their risk of infection.
So the doctor says it's critical to know your own risk. He's a little bit concerned that the COVID booster level is only 50% here in Utah. So he's urging everybody who's eligible for a booster to go out and get that booster. Also urging parents to get their kids vaccinated if they haven't already done that before the school year begins.